Mae gan dros 600,000 o bobl yng Nghymru nam ar eu clyw a neu ar ei golwg. Golyga hyn mewn unrhyw ystafell aros, y bydd un o bob 4 unigolyn yn debygol o fod â rhyw fath o nam ar y synhwyrau. Dylai gofal iechyd fod ar gael i bawb. Mae gan bobl â nam ar y synhwyrau wahanol anghenion cyfathrebu ac anghenion gwybodaeth na chant ei diwallu bob amser pan ei bod angen gofal iechyd.
When you're at home, you're suffering from severe sight loss, and you actually get a letter from the ophthalmology department, and it's in small print.
Cafodd y safonau Cymru gyfan ar gyfer cyfathrebu a gwybodaeth I bobl sydd â nam ar eu synhwyrau eu cyhoeddi ym mis Rhagfyr 2013. Nod y rhain yw sicrhau y gwneir addasiadau priodol I ddarparu diogelwch a gofal da I gleifion â nam ar y synhwyrau.
In my GP surgery, the nurse has made little adjustments for me. So I noticed with other people, she will, when it's their turn for the appointment, she'll call them from down the corridor and then they go to the room. But with me, she'll come out to reception and she'll call me then, and then I can follow her then round to the consultation room. So that's an adjustment she's made after noticing that I do have sight loss. And it's a small adjustment, but it just makes it a lot easier for me.
Mae gwaith sy'n cael ei wneud ar draws Gwasanaeth Iechyd Genedlaethol Cymru yn cael effaith bositif. Rydym yn hyfforddi ein staff I fod yn ymwybodol o nam ar y synhwyrau. Rydym yn defnyddio technoleg newydd I wella mynediad at ein gwasanaethau.
We worked with colleagues to come up with an action plan in terms of what we could put into place. Some of those things included giving patients who have a sensory loss alternative methods of communicating with us, for example. So we have social media feeds, but we also offer an email address if patients wish to email us because they can't use the phone. We've also put in place a system called My Health Online, which enables patients to register to use a system to book and cancel appointments online.
Mae ei reolwyr nam ar y synhwyrau yn gweithio ar draws llawer o adrannau I gynyddu ymwybyddiaeth ac I gefnogi staff I wneud newidiadau cadarnhaol.
I'm a sensory loss champion, and what it means is I go to my colleagues and friends in the health board, and if I hear there's a promotion or event involving something to do with sensory loss, for instance Sensory Loss Awareness Month, or some sensory loss training that I feel that would be useful, then I'll tell them that this is happening. Also, if somebody's got a patient coming in with a particular sensory impairment that they need advice on, I'm happy to give my advice if I happen to know a bit about that information.
Mae Gwasanaeth Iechyd Genedlaethol Cymru yn gofyn I gleifion â nam ar y synhwyrau ein helpu I wella ein dulliau cyfathrebu â nhw.
It's really, really important for patients to tell us if they have any form of sensory loss. You know, clearly that condition may not always be obvious to a member of staff when they deal with that patient. So if they can give us that information, we can record it on our systems, and that message can get out to anybody who comes into contact with that patient.
I think it's very important that people like myself tell health professionals that I have a dual sensory loss, and to tell them what I need and to give them a chance to succeed.
I would encourage anyone with sensory loss to tell the doctors or nurses or any staff in the services how they would like to communicate, to ask for the information in their choice of format, and if they're not receiving either of these things, to then share their concern.
I'm supporting the It Makes Sense campaign to make sure that people with sensory loss have equal access to GP and health services.